Hi, this is Pat Dillon. This video will depict assessment of the musculoskeletal system, the head and the jaw and the upper extremities. And we're going to begin by comparing side to side when we go through the assessment. For musculoskeletal assessment, we're going to be looking at the muscles. We'll be assessing them. You use inspection and palpation. We're going to be doing joint assessment, which is range of motion of the joint, the stability of the joint. Is there any redness or pain with movement or crepitus of the joint? Or are there any lesions or nodules or deformities noted? So we're going to start at the head, and we're going to take a look at the neck, and I'm going to ask you if you can bend your neck down and bend back, and then lateral side to side and side to side, and that is me creaking, and then left to right. And make your head a circle with your head. Okay, great. So Zaire has full range of motion of the neck, and I didn't hear any crepitus. Crepitus is a sound or grating sound of bone rubbing together or cracking. So the other joint that you're going to assess as you move down is the temporomandibular joint. So can you clench your teeth? And oftentimes patients with temporomandibular joint syndrome, they will complain of headaches or referred pain or ear pain, when in fact it is a joint. So open and close your mouth, and what you're feeling for is if the jaw, the joint should pop out, or if there's a clicking sound. Do it again, please. Okay, great. All right. Now we're going to move down to the shoulder. The shoulder is like a ball and socket joint, and sometimes it's easier to remember what the joint is or what type of joint it is, and that'll help you in terms of the movement. So since it's a ball and socket joint, what I want you to do is raise your arms up and then put them down, make circles. Okay, scratch your back. This maneuver is called athlete's maneuver. Bring them across in the front. Okay, great. All right, the other thing you want to do is as they move the joint, you want to place your hand over the joint to feel if there is any crepitus as they go through those movements. The other thing you want to do is feel the muscles in a relaxed state, the tone of the muscle. And then you're going to ask the patient to contract their muscles, so tighten up those biceps for me. Okay, great, and they have great muscle tone. All right, so then we're going to move down to the elbow, and the elbow is a hinge joint, so we're going to ask you to just bring them up and extend, okay? And then we're going to also ask you to supinate and pronate. Okay, great. All right, and then we're going to take a look at the wrist. Okay, and if you can bring them up, bring them down, make circles, and the cracking is me, not Sayir. Okay, and then we're going to take a look at the hands. So when you're looking at the hands, you're going to palpate the joints to note if there's any areas of tenderness, any swelling, any temperature changes in the joints. And then you're going to look for deformities. So there's two types of arthritis that I want to talk about. There's degenerative joint disease, also known as osteoarthritis, that's your wear and tear. Oftentimes people with osteoarthritis will have deformities on their distal interphalangeal joints, which are called your dips, and those hard nodules are called Herbert's joints. People with rheumatoid arthritis usually have more deformities. Remember, rheumatoid arthritis is more systemic and more joints are affected. And oftentimes you'll see deformities on their proximal interphalangeal joints, and these are called your pips. And the nodules that occur here are called Bouchard nodules. And there are no deformities noted on Sayir's fingers. So then the other thing you want to assess is the strength. So what I'm going to ask you to do is squeeze my fingers as tight as you can. And when you do this, make sure you cross your fingers, because if you don't, if the patient is really strong, they're going to mash your knuckles, it's going to hurt you. So this way, if you do it this way, it will never hurt. So give me a squeeze as tight as you can, and don't worry, you're not going to hurt me. Great, perfect. Okay, so hand grips is one way to assess, but we can actually assess every muscle group. So when you assess muscle strength, there's a grading scale that is typically used. It's 0 to 5. 0 means no movement. 1 means they could contract the muscle but not really move it. 2 means they can move but not against gravity. 3 means they could move the extremity against gravity but no resistance. 4 means they can move against gravity with some resistance, and 5 means they can move against gravity and with full resistance. And the resistance being applied is that of the examiner. So one of the things we're assuming is that you have normal strength, but I'm going to tell you right now, Zaire is going to be stronger than me. So let's go through and test your strength. So can you bend your arms for me? Okay, don't let me pull. Okay, good. Push against me. Whoa, okay, good. All right, raise your shoulders, really strong. Push up. Okay, good. And push against. All right, good. Push. Now, push down and pull back. Okay, good. And open your fingers. Don't let me close. Ooh, very good. Okay, close them and don't let me open. Okay. The grading scale that is typically used for muscle strength is 0 to 5, with 4 and 5 being normal. 5 is the patient's ability to push against full resistance. 4 is some resistance. 0 obviously is no movement or paralyzed. 1 is some movement. 2 means they can move but they can't bring the arm up against gravity. 3 means they can move against gravity but not resistance. So you're looking for 4 and 5s when you're testing these muscle groups.